Hi, it's Gene Ransom here, and I'm really excited today because we have Andrea Mullin with us, who is with the Medchi CTO. Andrea has got a public health degree from the University of South Carolina. She is a big Gamecock fan, and more importantly, she does a great job working for the Medchi CTO, and is going to tell us all about the primary care program. Andrea, welcome.
Hi, Jean. Thank you so much for having me today.
Thanks for being here. And I don't want to bury the lead for people. I want to start with maybe the most important thing, which is if you're a primary care doctor in Maryland and you take Medicare patients, you can make extra money doing this. So it's worth understanding and seeing if you qualify for this really exciting program. So why don't I start with a question that a lot of people probably have on their minds. What is the primary care program?
Yes, so the Maryland Primary Care Program, also referred to as MDPCP, is a voluntary program open to all qualifying Maryland primary care practices. The program is right now in its second year, and we're heading into performance year 3 for 2021. We like to highlight that the program provides funding and support for the delivery of advanced primary care throughout the state. There are 5 big primary care functions the program likes to build on: access to care, care management, comprehensiveness and coordination, patient and caregiver experience, and planned care and population health outcomes.
So Andrea, the primary care program, it's an advanced payment model, right?
Yes, it is.
So that means that you get the 5 points for MACRA after you've done it for a year. So that's pretty cool. So I guess a lot of people are probably going, okay, this sounds interesting. You know, how do you decide if the MDPCP is right for you?
Sure. So we want you to ask yourself 3 different questions. The first is, do you support the total cost of care model and the redesign of care delivery in Maryland? So with that being said, this program is going to help transform your practice and the way that you care for your patients. We also want you to consider, do you want to help the state meet the total cost of care model and its commitment to build on reducing Medicare fee-for-service and improvement on quality and utilization metrics? And the last part is, do you want to advance primary care in order to reduce hospital utilization and really provide preventative care for your patients?
So I brought it up a few times, and obviously it must be on my mind today, but I want to talk a little bit about money. Explain exactly, if you sign up for this, how do you get paid, or how does the physician get paid? What's the benefit to the physician practice?
Absolutely. So as I mentioned, the practice is about providing funding for, or the program is about providing funding for practices. So the payment model is a value-based comprehensive care rewards model. So in that, you are paid based on each beneficiary attributed to your practice. So that just means each patient is ranked, and they kind of have a monetary value assigned with them based on their amount of care and how complex their care is. So with that, you could get $600 to $100 per beneficiary, and that can add up quick.
Right.
In that, there's also a few different tracks. Sure.
So on top of that, though, you're also in the advanced payment.
Did you have a question?
Yeah. So on top of that, though, this is on top of being in the advanced payment model, right? So you get this money on top of your regular
Yes, that is.
and then you get the 5-point bump in the future. You get all that extra money.
You do?
Wow, that's a really good deal. So the doctor's going to get their normal fee-for-service payments. After they've done the program for a year, they get a 5% increase in those payments. And then they also get care management fees for a lot of the things they're probably already doing today in their practice. That's pretty huge. How much money came into the program in the first
Absolutely.
year?
Sure. So in our first year, between practices and CTOs, it was $67 million. And that broke down to about $176,000 per practice.
And obviously that's going to include really big practices like Privia that's got literally hundreds of doctors and probably got millions of dollars. And then the smaller practices might have gotten, $30,000 or $40,000. But we're talking about real money to primary care practices.
Absolutely. And the money does come in on a quarterly basis. So that is a nice little bump in that bank account each quarter.
So who's eligible? We've said primary care, primary care. What exactly specifically, which practices are eligible?
Absolutely. So the program is not that exclusive. So it does offer a lot of different specialties to join the program, anywhere from general practice or family medicine to a clinical nurse specialist or even a certified nurse midwife. So we do encourage anyone to look into this program because it does allow opportunities for a wide range of specialties.
And one of the things I remember is that if you are not designated as primary care, you don't answer this right when you're applying, it's a place where you can get thrown out. So it's important that you pay attention and pick one of the practices that's actually allowed to be in, correct?
That is very true. Yes, the application is specific, but the MedChi CTO is here to help you with that.
And we'll talk about that a little bit later, but MedChi will help anybody no matter who they're willing to work with. And if anybody has questions, so they can always reach out. So let's talk about eligibility.
Absolutely.
Okay. You're in one of the specialties that's covered. You'd like to make extra money on your Medicare patients. What do you have to actually be able to do or to have to say so your practice gets in?
All right. So with the requirements, the first one is just to meet the program integrity standards. And then we look at the beneficiary count, and that needs to be a minimum of 125 attributed Medicare fee-for-service beneficiaries. The next requirement is that you have an EHR that is a 2015 certified EHR, and that you practice in Maryland. Again, this is the Maryland primary care program, so we want to make sure that the practices in the program are serving our Maryland patients. And then the last part is that this is a transformation program, so we want to make sure that you're moving forward to track 2. And as you do that, just by the beginning of year 4 in the program, that you meet those track 2 requirements.
So, it's interesting. This was part of the whole total cost of care negotiation, and MedChi really lobbied hard for this program. In fact, it's something I think MedChi should be really proud of because it was really created as one of the things that we'd asked for as part of that whole negotiation a few years ago. With regards to restrictions, are there any rules or things you can't do if you want to be in the program? Let's say you've met all the eligibility requirements. What kind of knocks you out, or what are you required to say that you're not doing?
So there are 3 main restrictions or restriction categories here. The first one is that you cannot charge any concierge fees for Medicare beneficiaries. And then you also cannot be a participant in other CMMI initiatives, including ACOs, ACO models, and ESRD care model. And then the last one is just, you cannot be a rural health clinic or Medicaid health home. You can be a provider in an eligible practice. It just can't fall under that specific category.
Right, and prior to this year, actually, FQHCs or federally qualified health centers were also restricted, but they've lifted that restriction. So if you're an FQHC, this might be a neat program to look at, and you couldn't do it in the prior years.
Yes, that is true, and that's exciting that we can offer this program to even more providers.
So we've mentioned CTOs a few times in this, and there's about 20 CTOs in Maryland. You want to explain to everybody exactly what a CTO does and what they provide?
Sure. So a CTO is a care transformation organization, and they really are there to provide additional support and fulfill staffing needs of practices. So help connect practices to specific resources, including maybe learning webinars, tools, and again, if there is a gap in staffing, they can help fulfill that as well.
Right, so CTOs are really providing services, and about 80% of the doctors in the program are in some kind of CTO, correct?
That is correct.
Yeah, so the doctor, can go alone and try to do it themselves, or they can work with the CTO who will then be responsible to make sure that they can meet all the needs and work with them. Most seem to pick a CTO, and obviously the one CTO that you're probably most familiar with is Medchi. Do you want to tell us a little bit about the Medchi CTO and how that's been going?
Sure. So the Medchi CTO is in its second year. So we started when the program started, and we offer services related to diabetes management, transitional care management, or TCM, which is another way that we can increase the revenue in our practice's pocket. We also help fill the gap in patient transportation and really help decrease the amount of missed appointments for our offices. So help get those patients there. And then the big thing that we offer right now, especially with COVID-19 going on right now, is free access to a telehealth platform as well as secure patient messaging, and that's through Backline.
Right, and the Medchi CTO, actually, I saw that they just announced results for cost savings for I guess it was for 2019, and I saw that the Medchi CTO did really well. In fact, I think you guys were one of only 2 practices that actually saved money for the state of Maryland.
That is correct. We are one of 2 practices that saved money for the state of Maryland, and we are extremely proud of that accomplishment.
Yeah, that's really impressive. I think one of the things that you did really well, and you mentioned it, was really focusing on those high-risk patients. And I think the other thing that you did really well was focusing on transitions. When a Medicare patient ended up in the hospital, I think doing that transitional care really can help reduce costs because they don't end up back in the hospital, which is good for the hospitals too because they get penalized for readmission. So it's kind of a win-win for everybody, and it provides better health. One of the other things that's cool about the Medchi CTO, and you can correct me if I'm wrong on this, but anybody can join, right?
Yes, they can. So we are not we are geographically agnostic. So you can be from anywhere across the state of Maryland and be in our CTO.
So if someone goes to the list on the health department website, you'll see that you could have CTOs that are really very tied to a specific hospital or a specific region. Some CTOs are really just closed out totally in certain counties in the state. But we're one of the few that just takes anybody. And I think the Medchi CTO has over 20 practices. The cost issue too, with us being so successful, could be big in the future. I know they're not really measuring on costs, but in the first 2 years, but in year 3 and 4, they're going to start looking at cost a lot more. So it could mean the difference about whether you get bonus payments or not, right?
It could, that's for sure.
But again, Medchi is willing to help anybody fill out an application, whether they want to join the Medchi CTO or do their own. It doesn't matter. And let's talk a little bit about the application process. Can you let us know what's going on with that? How do you apply for this federal program that's only here in Maryland?
Sure. So there is a specific application and application portal linked in the description of this video will be some of the helpful either guides or even FAQs you can access, as well as a place for you to request an application and gain access to that portal. The application is open and it will stay open until July 14th. That is the deadline, July 14th. Put it on your calendar. You do not want to miss it. We also encourage you to start your application as early as possible. There are many different steps in there, and as it was mentioned before, the application can be a little bit specific, so we want to make sure that all of your concerns are addressed. And as Jean mentioned, Medchi is here to support you completing this application and applying to the program, so please reach out to us if you do need some extra support.
Yeah, and I think people could have questions on things like they need a letter of support from their clinical leadership. They have to have a letter regarding the owner of the practice saying they need support. If they have questions about those letters, they can reach out to us, and it's not a big deal. I know you're more than willing to help any physician who needs help applying or any non-physician who needs help applying for this program. So I just would really encourage people to reach out if they're thinking about doing this or if they have questions about it. It's a big benefit. So in closing, we just want to again reiterate the Maryland Primary Care Program is open for new applicants. It's open until July 14th. We would love to help you do it. Is there anything else in closing, Andrea, you want to tell everybody about the Maryland Primary Care Program or the South Carolina Gamecocks upcoming football season or anything at all that you want to share with anybody?
So I'm hoping that there will be an upcoming football season, but I do just want to remind everyone that the Maryland Primary Care Program really does result in more than a financial gain. It is here to support the overall healthcare transformation process of the practice, as well as improving healthcare of the patient. And we really hope that you apply to this program and join us in the MDPCP, really help get this care out to your patient.
Thanks everyone for joining today, and don't hesitate to reach out to Medchi if we can help you with anything.